1. And we're live. This is TikTok Live number 55. Top 5 listeners, guys. By the way, top 5 listeners that stay on for the full TikTok Live. Going to be giving you guys a shout out. It shows me, by the way, in the data of the live, it shows me who stayed on the longest. The top 5, I give you guys a shout out in the caption of the podcast YouTube, the full version when I send it out. Sam Miller.3 said, "How's your day been, man?" My day's been pretty good. The ortho clinic today, this afternoon, was really busy. Took out a bunch of premolars, which is fine. I don't mind it. Sometimes the kids can be, if you know, you know. Sometimes treating kids can be a lot, you know what I mean? And then managing the parent in addition to the kid, and then working with the orthodontist to do all that. Yeah, it's just the ortho clinic today that we had to help out with. It was a lot. There's a lot going on. But otherwise, let's see. In the morning, we had a lecture, rounded on the patients. I'm off tomorrow, actually. Actually, right now. Technically, I'm off right now. I'm going to the DR tomorrow morning, so that's nice. Catching up with you guys right now. Get a quick TikTok Live in. Put on the podcast in a couple days or tomorrow. Jackie M said, "Hi, long day of assisting crown preps today." Oh yeah. The crown preps can be those can be some long days. I got you. Yeah. How'd they go though? How'd everything go? Luke said Luke got the #1 gifter badge. Awesome. Thanks, Luke. User 49672659. What's good, bro? Just placed my first implant. Congrats. Nice. How many did you take to get comfortable? I mean, you're always learning more about implants, how to place them. I'm trying to learn from the restorative perspective how I can place implants better for the general dentist. That's something that I want to be able to go over with them. If they're going to send me an all-on-X case, I want to be able to plan it in DTF or like a implant planning software, and then show them the plan and be like, "Hey, what do you think about this being here? Do you want a little bit higher? Do you need a little more bone reduction?" Stuff like that. You know what I mean? You want to make sure that you're avoiding the nerve, the sinuses, stuff like that. Eric said, "Hi." Hi, Eric. Hamza said, "Quick loops review." I don't actually wear loops right now. I wear blank loops, so just basically safety glasses with the light that you could put on the front there. I like a wireless light where you just kind of go over the head like this and it turns on and off. I find that to be really helpful. Yeah, I just like blank loops. I like to get a macro view of the patient's mouth, their airway when we're doing sedations and patients are asleep. I like to get a good look at the vital signs, the O2 sat, keep an eye on how the patient is reacting to certain things. That's really important for sedations. And I prefer just to be able to have it all in one view without having to move or like focus into the little loop magnifying glasses or focusing on a macro scale. I like to just be in that macro scale the whole time. Luke, incoming D1, said, "Been enjoying the recent Spotify uploads." Which one? Wait. Thanks, Luke. This is really important feedback for you. Which Spotify uploads do you like? Which ones are you talking about? The quotations from the podcast with guests, like with Dr. Melanie. I put up 2 of those this week. Or is that what you're talking about? The quotes one? Let me know, Luke. I appreciate this a lot, really. Ash Arnold said, "What do you typically do on days off?" I do a lot of, for example, even if I get a couple hours off, right now what I'm planning, what we're working on is, one of my side companies is, we are working on getting implant patients that need dental implants, right? Whether it be from their general dentist, they have a referral, or all-in-X cases, patients that need a smile makeover, essentially, or, to fill in a missing space with tooth, that are interested in implants, getting them to the practice, like doing Facebook or Google PPCs and stuff, pay-per-click, and getting them to the practice. I guess I have an entrepreneurial interest, and that's one of the things. I think if we could do that for the future practice that I start working at in August, it'll benefit the entire practice, not just me necessarily. And if we could do that for the entire practice, we could do it for other practices as well, the right way. That's something that I find to be extremely interesting. That's something. Otherwise, exercise, days off. Most days off, I'm trying to get away from the hospital area that I'm in. I try to go out on Long Island to see family, friends, go to the Upper West Side with my girlfriend and stuff like that. But yeah. Try and just enjoy, unwind, and I push myself in the side projects. You know what I mean? That's all a big way of how I kind of escape. I escape into the side projects that I do. Jackie M said, "When okay, tooth broke to the gum line challenge, but challenged me and my doctor did it." Yeah, when it breaks down to the gum line, did you have to do crown lengthening? Maybe. Cerny Brat said, "I have 2 DUIs. Can I still be a dentist?" I think it's going to come down to the dental school that you apply to. It's also going to come down to your DAT score, your prerequisites, your GPA, what school you came from. You got to look at the whole picture. It's not going to come down to one thing. Yeah, that's something to consider. Dylan Join, what's up, Dylan? Sam Miller 3 said, "What was your least favorite prereq for dental school?" Oh, geez. I mean, specific prereqs for dental school, we didn't have to do. I did not. I went to an engineering school where these people were they were born doing physics. I wasn't a physics fan. I was more of the organic chemistry fan. I loved organic chemistry. But otherwise, maybe Gen Chem was organic chemistry. I loved. It was like a puzzle. I love Sudoku puzzles. It was like a molecule version, just to me, in my perspective, it was like a molecule version of Sudoku puzzles. That's why, yeah, I really enjoyed organic chemistry. I got A minus the first time and an A the second one. Yeah. Eric said, do you work with other healthcare professionals? Oh, yeah, man. In the hospital, all the time. We got to get clearances. I mean, there's a case going Monday. We had to get like rheumatology. We had to get hematology. We had to get like the primary care provider. We had to get, there was a bunch of specialists that patients have to see sometimes. And you need to get, depending on how the severity of the condition is. Like, for example, if they're on a million different blood thinners, they have a really bad bleeding disorder, they have a clotting disorder, stuff like that. You need to make sure you set the preliminary, you got to get the clearances. You got to get the notes saying that, there's no contraindications to surgery at this time. That's essentially what we look for in that regard. Eric Bakla said, do you know anything about the process of practicing with a European license? You can't practice in the United States with a European license. No, you need a United States license. And generally, you have to repeat some years in dental school in order to get that in the United States. Musa said, can you talk about your first day of residency? What were you feeling? Oh, I mean, of course, whether it's dental school, working, residency, you're going to feel nervous, right? That imposter syndrome sets in. But you just got to remember, you got there for a reason. You're taking it one day at a time. They might not lay it out to you. You might just be jumping in the deep section. But look, you're going to do it. You're going to be just fine. One foot in front of the other. Break everything down into little bite-sized pieces. And what I found that helps me out the most, I use that app, To Do by Microsoft. It's an app. It's a to-do list. It's a calendar. It's folders for organization. I put everything in that app. Things repeat daily, weekly, monthly, or every day of the month. And everything goes really well using that. I just pack everything on there. I'll wake up in the morning. I got a list like this of 35 different things. Just start knocking things off one by one. Your anxiety starts to ease, and you get so productive doing it that way. I rely on that all day long, every single day. And I have been since my third year of dental school, actually. Third year of dental school when I started doing that. So that's literally been 5 years I've been using this app. Yeah. So that's literally my secret. This app I just use all day long. 2Sassy4U2 said your thoughts on the new studies on root canals. I haven't looked into the new studies on root canals, to be completely honest. All I know is now endodontists are placing implants, and it's like, your specialty was to save the tooth. Now everyone's just trying to place implants. Why? Because it's the most lucrative part of dentistry, generally not covered by insurance. And it's like, but it's like we're not even saving teeth anymore. We're just popping in implants left and right. Everyone's doing it. So what? I don't know. That's not the dentistry I knew coming into it. Sydney Stauffer. What's up, Sydney? Doing OMFS. Did you ever struggle with watching procedures with high amounts of gore? In the beginning, yes. But, with anything, the more exposure you get to it, the more comfortable you get to it, the more used to you seeing a certain thing, the more blood and more crazy stuff. You're going to be just fine, Sydney. You really, I promise you. Okay? Just give it time. Get exposed to things as much as possible. A lot of reps. How do you get stronger with push-ups? You got to do a lot of push-ups, right? And you can't just do one day of push-ups and expect to get strong. No, you got to do push-ups consistently. But, you do workouts, but then time and time again, maybe every 3-4 days, you do them again or every day. Sharon said, what are your best study tips? Guys, I can't stress this enough, especially in your first year of dental school. You need to learn how to do this. Transitioning from undergrad into dental school is a change up to like 32 credits a semester. That's what they say is like start when you're starting dental school. The way you accomplish that is by efficient and effective studying. So let's start with effective studying. That's getting higher scores, C, B, A, high A's. But then you want to work on efficient studying, maintaining those A's and studying less and less. My secret that I didn't figure this out till second, third year of dental school, D2, D3 year. I figured out by doing Quizlet cards. Quizlet cards, I bought the premium version. I would put figures on every single card. And I would break it up into question answer, right? And I would put, if it's topics with multiple questions, I would put A, B, C, and then on the back, answer A, B, and C. Okay? Different figure on every single card if you can, and just get those reps in. If you're really going to do it, get a team together of dental students, 2-3 people, and do those Quizlets based on the PowerPoints that they send you in advance. Get those Quizlets in there early so that when you're sitting in class, you're not making the Quizlets, you're adding notes into the Quizlets from what the professor or attending says that isn't in the PowerPoint. That's probably going to be on the exam, right? They always talk during those PowerPoints about what's not on the slide that you need to know. That's probably high yield. You need to get that on that index card. This is how you maximize those sessions, okay? Miam said, favorite surgery to perform. Wherever I do wisdom teeth extraction will always be favorite. Yeah, I do enjoy doing wisdom teeth. Wisdom teeth's a lot of fun. Sedations, all on X implant cases. I love to plan those and see where the nerve is. I think it's just awesome planning out those on DTX on that software. See where all the critical structures are. Just make it happen. Tammy Neotio said, hi. Hey, Tammy. Hi, Tammy. What's up, Tammy? And after that, after Tammy said, where's Tammy? Here we go. Sarah Pinto, what is dental insurance not rolled into health? Why is dental insurance not rolled into health insurance? Well, I could be honest, like all of insurance is kind of not doing so great right now. Why is it separate? I don't know. I mean, dental insurance is not doing great. It's like a little discount on what treatment actually costs for a dentist to do it nowadays. It's insane. And it's only gone down. Believe it or not, it's gone down in the last several years. Why is reimbursement going down and everything else? The cost of education, the cost of treatment, the cost of keeping the lights on, the cost of real estate, the rent, the technology cost, the materials cost, the composite, everything goes up. But reimbursement to that dentist that did that treatment has been going down. I don't know what's going on with the system, but we got to fix this, guys. TZ said, if I'm currently a business major and I just finished my first 2 years in community, is it too late? No, it's not. It's not too late. No. But you got to make sure you get those prerequisites in, right? You want to make sure that you're getting the gen chem, the organic chemistry, the bio, maybe a little reading, math in there. I think that's everything, right? PAT you can learn on the side. Yeah, you got to get those prerequisites in. And no, it's not too late. Apply. People say, what do they call it? The non-traditional route, where you're not like a bio major or pre-med or pre-dental. That's a big chunk of dental schools now, is like that non-traditional path. Like you take some years doing another thing, then you come back and go for dentistry. That's the norm. So don't count yourself out. User 86611, what is the protocol for if the lingual plate breaks during an extraction? Well, hopefully you got to be careful. You don't want that to happen. If it does fracture, keep it. Try not to manipulate it too much. Try and keep it to the periosteum as much as you possibly can. Once it comes off the periosteum, now you're losing blood supply and you got to take that out. Okay, this is not medical advice, by the way. This is just, in some cases, general knowledge. In some cases, but yeah, the periosteum is where large percentage of that blood supply goes. You don't want it to necrose. If it separates from the periosteum and it loses blood supply, it's going to necrose over time. And yep, that's not good. Jake B said, I go to dental school. It's not integrated with the med curriculum. Where should I start for the CBSE? This is where I want you to start, Jake. Go to the YouTube that we did, or podcast, whatever you like to use to consume material. I did this with Brandon Axelrod last year. It's called CBSE Dissection. We laid it out. It's 45 minutes. Put it on 2 times speed, whatever you got to do. We laid it out what you need to do to crush the CBSE to the best of your ability. That's probably what you're going to want to do, right? I would listen to that podcast, listen to YouTube, just search it. I've gotten a lot of feedback. Dozens of students have hit me up and said, it was a year ago we did this. So it's very up to date. Use this and you will crush that CBSE to the best of your ability, okay? Eric Newen said, did you end up finding out your board exam results yet? Dude, I haven't found out yet. It's been 2 months. I don't know with the boards. No one does. We don't know. People found out about the verbal boards, which was actually after our written. I just took the written boards this year. Next year's the verbal boards. The verbal boards found out this year already, but they didn't send out results of the written boards. So I don't know what's going on. You know what I mean? Nobody knows. Luke said, yeah, Dr. Melanie, and some of the other longer ones, but enjoyed some of the shorter ones like No Mansion. Oh, yeah. Okay, so cool. You're liking the quotes. Luke, dude, thank you for this. I really appreciate that feedback. I'll keep it going. I'm trying to do like every morning, in addition to like the clip from the podcast to give advice on I'm trying to do that quote with just I'll just rant. I'll just go on a rant, given a quote from the podcast, a guest quote, something that we were chatting about, or from the TikTok live. I'm trying to look for quotes that really resonated with me in that moment that I think I could give a little bit more elaborate. I could elaborate on a little bit more. So Luke, dude, thanks for letting me know that. I really appreciate you letting me know what really resonates with you. I'll keep doing that. I want to try and do it every day, honestly, because I love the podcast formatting. I think it's just fun and very insightful for people that appreciate long form content, right? Tony, do you plan on performing orthognathic surgery after you are done with residency? I mean, I got to see how easy it is. Right now, the risks of orthognathic surgery, you have to take time off from your office. You have to go into the hospital setting. The hospitals I work at, they don't really make it that easy for you. One of the hospitals does. The other, they're missing instruments. I can't get an instrument to do a mandible fracture at one of the hospitals. Happened this week. Couldn't find wires. Dude, no, I'm not messing around. And then the hospital takes most of the money. You have to bill it out to insurance on your own. I hate to say it, it's such a hassle. It takes away from your. I like to get in a flow when I work, right? If I got to go into a hospital setting, first of all, there's absolutely no flow. The hospital dictates everything. I don't really like the setting. I don't really like the environment of the hospital personally. I want to get in a clinic. I want to be working with. I could see so many more people and patients in the clinic. I could help 10 times as many patients, maybe more, in a day's time in the clinic I'm going to be working at than in the hospital. In the hospital, you might get 2 to 3 maximum in a day. I could get 20, 30, 50 patients even in a clinic setting. I want to help people, man. That's what I went into this for. I don't want to get pulled out and go mess around and do work for the hospital. In order to get hospital access, you got to take call for them. They don't pay you for call at some of these hospitals. I'm not messing around with that, man. No, I want some respect. You know what I mean? I want to work just with and for patients. I don't want to work and do hospital labor. I'm sorry. Like, they got to work on that system and make it better first before, I don't know. So just my thoughts. And yeah, I am liking orthognathic surgery. I'm really liking it. I got a bunch coming up. We got 2 next week. We had 1 2 weeks ago. We got a bunch coming up in April, May. And yeah, it's life-changing to fix someone's dental facial deformities and give them a nice facial, the aesthetics, get their jaw, their teeth back together so they can speak, chew, be confident again. Yeah. So no, it's really disappointing. You know, it's like $1,500 a procedure that's literally worth over $100,000. All the risk involved, all the time, the months of planning, multiple specialists between the orthodontist, the oral surgeon, the general dentist. Like, dude, there's so much that goes into it, and I feel like it's so underappreciated now from the system. The insurance system is dictating most of that. Anyway, for another time, man. Don't get me worked up. I'm so disappointed because I like orthognathic surgery, and the system does not make it easy for you or feasible, literally feasible. You're literally losing money by taking time out of the office to go to the hospital to do orthognathics. Yeah, I want to do it, but even losing money, they make it such a hassle to get it done. All right. You guys got me on a rat 17 eat cat. How hard do I press when brushing? No, you don't want to press very hard at all. I recommend getting an automatic toothbrush, one of the, the electric toothbrushes. Most of them will light up red when you're brushing too hard. Why don't you want to brush too hard? You got to push your gums down. You're going to cause gingival recession. You don't want that to happen. That leads to sensitivity. That's what I got. I was trying to brush my teeth like hard when I was younger, and I got a lot of gingival recession now, and it's not good. Sam Miller said, what made you choose dentistry over medicine? When I was shadowing all the dentists, they all own their own practices. The doctors I work for big hospital institutions. The quality of life was 10 times better in dentistry. Within the last 10 years, dentistry has gone significantly more corporate than it was. And, you don't really get to dictate, and you don't have as much autonomy over your schedule and stuff from the dentists that I've talked to and observed myself that work in corporate environments. So, yeah, it's changing. But yeah, I would still pick dentistry over medicine. I would pick it by far. I would. But I'm hoping that we can make some changes to dentistry and show that, like, predicated by insurance plans, new insurance programs, and show that healthcare can be made better when patients actually get better access, less things are denied. You could work with the doctors to accept more and what needs to be denied rather than working against them, which all these insurance companies are now. So we need to modify. You can't even reform insurance companies at this point. You need to start a new one from the bottom up, work with the dentists that are on that insurance plan, work for the patients that are paying you. And I literally create an algorithm, a formula using ChatGPT to factor all these things in down to the zip code. I'm ready to go. I just need help. I don't even think it's fun. I really don't want funding. I just need dental offices, bulk dental offices that will take the insurance. That's essentially what it's going to come down to. I'm going to need a lot of help with that. Jala said, would you say you have to study to make the exams, or are you naturally smart? No, I have to study a lot. I believe, and I've been told I'm more naturally gifted I was top 3 in my dental school class, hand skills wise. And just based on the scores and stuff that we found out, one of the teachers told me the number 1 top score on 3 out of the 4 prosthodontic exams. And hopefully that was true. That's what I was told. But I would have to study a lot. You know what else I made the mistake of? I kept trying to write things down to study. And that took forever to learn material. And when you're in dental school, you're taking like an average of 32 credits a semester. That's what it comes out to the equivalent of. You don't have time to write things all day and night long. Get on the computer, get on Quizlet or Anki or that new program that they have, and get those reps in. That's what really made me get better scores. And I still use Quizlet to this day, believe it or not. So figure out how you study best for you. And maybe you do better by listening to recordings. Dr. Harris from Austin, Texas. Plaque. Shout out to Dr. Harris. What is his plaque something. I forget the second part of his handle. But he was saying how he used to make recordings and listen to that. That's how he was a big studier. That's awesome. You need to find what maximizes your studying. Okay. Luke said longer ones, easier for the driving, work, and commute. Got it. Longer ones for the, longer podcasts are better for the commute. I'm totally with you. I listen to podcasts on the run, on the treadmill, working out sometimes. I like to use that time to step away from all the academics and this and that. I like to listen to a lot of Gary Vaynerchuk. I do like Joe Rogan's podcast, listen to some of the interesting people that he has on. I like a couple, I love Lex Fridman's podcast. Those are probably my top 3 favorite podcasts right there. Yeah, I would say that. Oh, another one. I listen to Our Daily Bread every day. That's a Christian podcast. They go over a Bible verse and how a teaching that has to do with a lesson and how it relates to your daily life. I love that one. Every morning, I got to put that in my ears when I walk into the hospital. So that's another one. Those are my top 4 right there. Teasy said, I lost it. Where'd it go? Rejoyce said, thought on perio residency. It's a great residency. They're doing a lot of things in perio that when oral surgery, well, the political system, the hierarchy of dental schools sends a lot to perio, but then perio is doing a lot of stuff that oral surgery used to be the only ones doing. So that's an interesting side of it. I would also be careful with perio because a lot of people are venturing out of their scope. You got to be able to, if you can't handle the complications of it, you probably shouldn't be doing it, right? And that's with any specialty, even oral surgery, right? It's very important. Very, very important. Rai B said, how do you study without getting tired and losing focus after a long day? Do you drink caffeine every day? Yeah, I drink a lot of caffeine. I probably average 2 cups of coffee in the morning. Well, it might be more cups. Like I'll have a mug here in my apartment and then I fill up a to-go mug. That might be it's a Starbucks like to-go mug. That might be 2 cups in itself, to be honest. 2.5. Oh, jeez, how much coffee am I having? Maybe that's why my eyes been twitching for like 6 weeks now. Yeah, that's so definitely more than 2 cups. Probably like 4 to 6 cups of coffee if you break it down in like that little tiny cup. Yeah, but yeah, dude, I lose focus after my brain starts shutting down around 10:30. Like when I say shut down, like off. Yeah, and after 10:30, I'm really just kind of like trying to finish up any tasks that I do. I just watered the plants. I do my Spanish lessons every night. Got to do my Spanish lessons, Duolingo and Babbel. Takes a bit of time, but you got to do it. You know what I mean? Maybe I'll do the question of the day. Doesn't take too much mind. And then I just have a nice, easy wind down, a hot shower. I set up my breakfast for the next day, my clothes, the workout clothes, the scrubs. I set up my breakfast in the morning. I put together my lunch for the next day, shower, and then head off to bed. It takes like an hour and a half to do all this. But having a nice 1 to 2 hour wind down where you hit that like 10 o'clock turn off, shut everything off, start getting ready for bed. Guys, that's really important to have your little space, your little time. I started doing that during COVID. I used to shut my phone off at 9 p.m. during COVID. That was awesome. What do you do when you shut your phone off at 9 p.m.? Yeah, it was literally life-changing. You start reading books, listening to more podcasts. You get your routine at night, shut the world out. This is your time. And then you get up earlier. You get the morning early bird catches the worm. Anyway, let's keep going. Haley Richling said, no doctors on live went in to answer my question. Please answer. Can aligners cause TMJ? Fortunately, Haley, yeah, aligners, depending on who did it. Is it clear aligners? Is it Invisalign? Did you do it with an orthodontist? I hope. Yeah. Can it cause TMJ? Yeah, it could cause TMJ issues if aligners are done incorrectly. If your bite changes that significantly and quickly, yeah, that can mess with the joint, right? Your joint is like a lever. And if you switch, like a lever, one of the things like these, it's a type 3 lever. So it's like this. This is the mandible. Yeah, if this turns into like a full range of motion, turns into more range of motion or to the side, yeah, that's going to mess up your TMJ. We see that sometimes. Jay said, hey, doc, did you used to study Panera near the mall at Stony? Yeah, dude. Jay, what's up? That's the Panera I went to study. How about that? Yeah, the one that looks out towards Dick's Sporting Goods and Sears used to be over there. That's the one near, what is it? The Cafe Havana? No, Caribbean, whatever the Caribbean thing is over there. The tire shop, Aldi. It's an Aldi's in the center. You have Umberto's Pizzeria over there. You have like a running store. You got the wine store. You got Citibank right there. Yeah, dude, that was wow. I studied there for years, day and night. When I was studying for the CBSE in between D2 year and D3 year in that summer for months, I would go there. I would get there when it opens. I would study all day, and I would leave when Panera closed. Wow, that was. Gosh, man, the memories are making me look back. How about that? Bethany said Owen Hunt. Haley Richling said, my jaw gets strained not being able to bite down. Never had TMJ issues before until my bite got messed up. Haley, I'd like you to really see. I know it might be time consuming and expensive. I would like you to see an orthodontist about this. If you're not seeing one now, I'd also like you to see an oral surgeon that really focuses on the TMJ. Okay. I would get this looked at. That's before it gets worse. You see what I mean? Sam Miller said, is there any pros to getting a 3.9 science GPA in comparison to a 3.65 to 3.7 after getting into dental? Any pros? Dude, just go for it. Don't worry about it too much, okay? Keep getting the best grades that you can, but don't worry, like, focus on that DAT, focus on those extracurriculars, okay? Think about those letters of recommendation, shadowing hours. There's so much more to the application than just one thing, and both those GPAs are excellent. So Puru said, 1997 said, when can I start studying for the CBSE or USMLE Part 1? I would study for the CBSE. Get down D1 year first. Towards the end of D1 year, then you could start thinking about taking the CBSE. You don't necessarily have to study for it just yet. I would recommend taking that CBSE so that you know what you're studying for before you go and try and crush it, right? Get an idea what this monster looks like before you try and size it up. That's my analogy. Damon said, what's your plan after finishing residency? Yeah, dude, I finish in 10. We're down to 10. I got 10 weeks left of residency now. I have a lot of surgeries still to go. But yeah, afterwards, I'm going to travel a little bit. I want to go to Europe. I would really like to see London. I would like to see Ireland, maybe one day Germany. I would like to do that. I'm going to move out to Smithtown. I want to buy the house I grew up in, my dad's house now. Buy that. I want to live there. I'm going to be working starting August 15th at All County Oral Surgery in Melville. And yeah, just kind of laying roots out there, relaxing over the summer, enjoying the time off, getting away a little bit, seeing friends, family I haven't seen. Yeah, and just kind of organizing the house and stuff, you know? But yeah, it's going to be a process. Bisano Nicole said, could my mandibular tori be affecting my speech? It could potentially. If you have big mandibular tori on the lingual side, they could be pushing up your tongue. And having your tongue in a displaced position can affect your speech, right? Your phonation. Absolutely, that can happen. I would get a consult with an oral surgeon about your mandibular tori. I would. Joelle Cabrera said, how did you set up studying for your DAT? There's a lot of resources out there. You have Booster, you have Boot Camp, you have Kaplan's courses, Crack the Dat, Chad's videos. All these are excellent options. And try and do them all if you can. You know what I mean? Don't leave anything on the table. Get it all in. Study your face off. You don't want to do this again. You don't want to do this twice. If you have to, sure, you can. But go into it like you're going to be one and done. You know what I mean? And just study as much as possible. Rejoyce said, thoughts on prayers? Oh, we did that one. KDS and NFL, what are some tips for an incoming D1 student? Yeah, dude, I'm telling you, efficient and effective studying. Effective studying, getting higher grades, obviously, but efficient studying is studying less to maintain those high grades. I figured that out with Quizlet. Quizlet was how I studied, using the premium version to get the photos, the clinical photos, the x-rays, radiographs, diagrams on there. I'm a very visual learner. You might be too. Get those reps in with visual cards on those question-answer Quizlets, okay? That's my recommendation. Sarah Kate said hi. What's up, Sarah? Matt Zano said, what activities did you do during undergrad to become a competitive dental student? I joined a lot of clubs and stuff. I played basketball in college. I joined a couple clubs that I was passionate about. I joined the Irish club at Stevens. I was in the Catholic club at NYU Poly. I looked into research to add that onto the application. Some things like that. Do what you enjoy. Not everything needs to be just for dentistry, teeth, dental school. Do stuff that you love. You're going to find that when you get into those interviews, you're going to be talking about those experiences, your sports experiences, your instrument experiences, your club experiences, stuff like that. Working in a dental office, shadowing, observing. That's what you're going to be talking about on those interviews. I would give that a lot of thought and spend a lot of time doing that, okay? Tori Allen said, I love your very informative videos. I actually want to be an OFS person in the far future. Do it, Tori, and thanks. I appreciate that. Go for it. And I'm here. I'm going to be making content as much as I can, you know? Christy Sambazi said, are you doing a fellowship? I'm not doing a fellowship. I want to work. I want to get out of work. I want to buy a home. I want to start a family. I want to move on with my life. I know how to take out teeth. I know how to do all oral surgery procedures. I want to hone into my favorite ones and do it the best I can and make the patient experience great. Literally my dream. It's time to do it now. You know what I mean? Just my thoughts. And followed the live creator. Thanks, Banyan. Frank Rosato, how do you feel about new doctors wanting to jump quick into all on X cases when they have never placed an implant? Frank, that's probably not a good idea. You know what I mean? That could be extremely dangerous. First of all, it's not just an implant, which is now an invasive procedure that you don't typically learn in dental school. All on X, you got the nerves in the way. You got bone reduction. You could fracture a mandible. You could hit an artery. There's so much risk involved. Tori Allen, Quizlet is very useful. Yeah, Tori, dude, Quizlet is best. Joelman said, must be nice to have technology us 50-year-olds didn't have. I agree. We got it now, so we might as well use it. Joelman's Dr. Chavkin. He's my boss. I signed with his practice. I'm going to be working. He's the boss of all the all-county offices. Yeah, he's literally a legend. He's getting ready for boating season too. If you look on his Instagram story, he's getting ready for his like triple 500 horsepower engines, fishing and boat and Dr. Chapkin, do you water ski or the wakeboard? No, right? Just fishing? Just fishing, right? I actually meant to ask you that. I was talking with Josh about it yesterday. Josh is one of my co-chiefs. Shout out to Josh. Let's see. Sue Weiss Cheese, follow the live creator. Thanks, Sue Weiss. Rejoice said, are you using surgical guides for implants now? Sometimes yes, sometimes no. For bigger cases with anatomy and very critical positions, yeah, I'm going to want to place a guide so you can get it down to a millimeter or less, exactly where you place it according to the programming. Yeah, right. So we were up to where to go. Wow, I missed a lot. Haley reaching ortho clear aligner. So you went with an orthodontist. You need to talk to your orthodontist about that your bite's changing and it's affecting your TMJ. You definitely got to talk to someone about that. Lily said, do you have a skincare routine? I don't have a skincare routine. I probably should. I'm trying to learn Spanish right now. I don't on top of everything else. I'm not trying to do my skincare routine. Kira Yoshikaj said Stab Lab was kind of crazy. Yes, Stab Lab. Stab Lab could be at our dental school. They didn't even let us quote unquote stab each other. Peru said, when can I start studying for this? I'm in my D3 year. Yeah, you should. Peru, not 199 1990. You should start studying for the D3 now. You're in D3 year now. You should be studying for that CBSE. Yeah, you're finishing up D3 year. You got to apply to oral surgery, man. You got to get that. You got to get that CBSE under your belt. You know what I mean? Sarcade prosthodontics, ew, but good for you. Haley Richland, do you struggle with ADHD at all? I have ADHD and struggle studying. Maybe. I probably have something. My thing is, I do not like to use pharmacology agents to interfere with that. My thing is like focusing on, I know it sounds like very abstract. Every doctor just wants you to prescribe you Adderall or Vyvanse or something. I don't think I have ADHD, but I might because I do hop around between different things. When I drink, I get really like my attention goes off the walls. But I would say, no, I focus on saving caffeine just for when you're really studying, okay? In residency, you're always learning and you got to stay awake and stuff. So I have caffeine every day. But when I was in dental school, I really just try and have drink caffeine, coffee when I was studying, okay? Another thing is breathing exercises. If you slow down and focus on your breathing and look up breathing exercises online, you can actually manipulate your focus in two different ways. Look, not everything. This might not be able to solve all forms of ADHD, but maybe give it a try before you move on to stronger levels of ADHD treatment or management, right? That's just my thoughts. Bethany, now with all the AI apps, you can just push record and it'll type out all for you while you listen. That's pretty cool. That's pretty interesting. I've been using a lot of ChatGPT and Grok. Those are my two go-to AIs right now. I'm learning how to use those, you know. Jenny Shelley, how do your teeth affect your heart? What does it do to it? Well, a lot of the bacteria, if you don't take care of your teeth, you don't take care of your oral hygiene, some of those bacteria that affect the teeth can get into the bloodstream and go to the heart. This is proven. Everyone knows this. In the hospital, before they get heart surgery or certain transplants, we do a dentistry evaluation to see if, do they really need teeth removed right now prior to going to that surgery, right? We really try not to delay the critical surgeries like a heart transplant. We try not to delay that at all. But if someone has completely bombed out teeth everywhere with periapical abscess or an active abscess, yeah, we got to get those out before they go get a new heart, right? Haley Reekland said, yeah, you said that. Bisono on a call said, can my member talk changes with the speech? It can. We went over that. Santa Cruz Medicinal said, transferring to SBU, Stony Brook University, is a pre-dental. Any words of wisdom? Great school, great for pre-dental students as well. Yep, study hard. Tori Allen said, Bison on a call, of course. Yes, I know because I have a speech impediment. Alondra said, how did you get shadowing opportunities during undergrad? I would talk to people in my network. Hey, do you know any dentists? Do you know any doctors? I'm looking to shadow and learn. I'm looking for a mentor, someone who would be interested in having me, in their practice or at their hospital. And that's what I did. Three out of the four dentists that I shadowed in undergrad, I met at the gym. Yeah. It was awesome. They were awesome. They're still my mentors to this day, believe it or not. Bisono Nicole, I'm in dental hygiene school, but I'm interested in dental school. Are there any activities I should... Yeah, there are activities. I don't know. I'm not seeing where you're... Braden said, what was your undergrad major? I graduated from Stevens Institute of Technology with a chemical biology major. I transferred after my second year at NYU Poly, which was biomolecular sciences over there. ID NYC 248. What advice do you have for my brother? He's about to start D3. He wants to do general dentistry after. Yeah, look at what general dentistry opportunities are out there. Do you want to do further training in a GPR? Could be an excellent idea, or an AEGD residency, right? Do you want to go right into practice? If you're going to go right into practice, you're probably going to want to get a mentor. You're going to want to go into a practice where someone can actually mentor, like show you that they're willing to mentor you, right? Aiden O'Sullivan said recurrent jaw dislocations. There's a lot that could go that could have to do with. I mean, I would start with conservative treatment. I would be very conscientious. Be careful when you're biting into a bagel or a burger, and you can always visit an oral surgeon to get a consultation about that. An oral surgeon that focuses on TMJ. All right, guys. Only a couple more. I'm sorry, guys. I'm not going to be able to get to everything tonight. I gotta pack. I'm leaving for the DR in the morning. Luke Haganman, what's up, man? How often do you premeditate patients with antibiotics before surgery? Not as often as you think. We only do that generally in oral surgery if they come with a clearance or a medical optimization letter from their primary care provider or their orthopedic surgeon or their their cardiologist saying that they need that, then we generally do that. Okay. Moha 645 question: my implant is still allowed for GPS in US, but abandoned. Your implant is getting caught on the GPS? What? Wait, I'm not following that. I'm sorry. Ahmed said, haven't taken the DAT yet. Is it worth going to dental school? Well, I would shadow some dentists. I would take a. Ooh, am I getting a blister from my workout today? That sucks. Jenny Shelley said Haley Reachling. They said ADHD make great doctors. Maybe that's true. Ahmed said, hey, I'm a senior with a 3.2 GPA. I plan on going to dental school. Do you think I would get in? And I haven't taken the DAT yet. Is it worth it? Dude, you got to get exposure to what the profession is in. You got to see what multiple dentists do, what their practice is like. Are they working for corporate? Is they working in a private practice? Do they own their office? Get an idea of what you envision yourself in. You're only going to do that by getting exposed to it. You need to observe those dentists in their day-to-day setting, right? Matt Zano said, any words of wisdom for pre-dental student? Any tips that you wish you knew? Yeah, I wish I knew how to study like that earlier using Quizlet. I'm literally telling you, get Quizlet, get the reps in, learn how to do question answer, put figures on there, and it's going to save you so much time. You're going to get higher scores, I'm telling you. All right, friends, I got to head out. I got to do this. All right, one more. Let's go. Dental implants are not allowed for general practitioners in so many countries. Makes sense to me. It does, but the whole insurance isn't covering this and that. Insurance doesn't reimburse adequately enough. They push everything towards implants now. That's the issue. Yeah, we shouldn't. I mean, I don't know if some implants are easier, but you have periodontists, you got oral surgeons that are experts in implant dentistry. I don't know why it has to. There's no reimbursement for preventative care anymore. It's not enough to keep a practice open. Class 2 preps and fillings tips competency is pretty hard. Yeah, really work those burrs. If you look in your burr kit, your burr block, look for, you need to make the shove. You need to make the margin. You need to look at the width of the margin. Then you need to shape the margin. Look through, use a different burr for all those things. I'm telling you, do that. Do you use Gluma? I don't know what Gluma is. Yep. Good night, guys. All right, friends. This is, by the way, TikTok live number 55 now. The top 5 listeners that were on the whole podcast. I'm going to be giving you guys a shout out in the caption on the podcast and YouTube, okay? All right, guys. All right. Love you guys. Thanks for coming on. Love you guys, my podcast fam. I'll be getting this up in a couple days. I wish you guys a great night. All right? All right. Have a good rest of the week. Happy Friday tomorrow. Happy Friday.